interesting because the science on COVID, on the lockdowns, on the mitigation measures, on a whole host of topics, were if the public was listening, they would hear this idea that there was this univocal sort of univocal conclusion that you had to do lockdowns, you had to wear masks, you had to socially distance, you had to put plastic barriers up, you had to close schools, you had to do all of these things, that the vaccines would stop transmission of the disease, that therefore it was warranted to force people to lose their jobs over them. All of these ideas were sold as if there was a scientific consensus in favor of them. That was a lie. There was never a scientific consensus on almost any of the topics. And as you say on masks, in fact, the pre-existing narrative, the pre-existing idea among most scientists before the pandemic was quite the opposite direction. What happened was a relatively small group, a cartel almost, of very powerful scientific bureaucrats took over the whole apparatus of science, at least as far as the public eye was concerned, dominated the media, dominated the message to politicians. And as a result, we had a catastrophic response to COVID, and we're going to be paying the cost of that for a very long time.